with us. Again, I'm B. Nichols, lead for environmental health and safety and one of DFSS's assistant directors.
Good morning, everyone. This is Rhonda Anderson. I am a project coordinator with the Department of Family and Support Services.
Good morning, Gina Pasella, CPS DFSS Disabilities Team Leader.
Good morning, Alicia Castañeda Rodriguez from the Carol Robertson Center for Learning, Social Service Director and Disabilities Coordinator.
Good morning, everyone. Jennifer Santana here, Data Support Service Coordinator.
And so before Jennifer goes into webinar etiquette, I just want to thank Alicia for being here with us this time. And I also want to say that Sharita will be joining us. The second half of this webinar is all about your questions and your answers. And so what we did was poll and ask you all to give us some ideas on things that we've already either been through or things that we haven't covered that you would like for us to cover. So even though this is the end of the webinar series, it's still all right if you go ahead and send us your questions that you have, and we'll try to get through that today. All right? So Jen, you're on.
Okay, good morning, everybody. I just wanted to double check and make sure that everyone is logged on. If you are and you can hear us clearly, just go ahead and type yes in the questions panel. That way we know that you're live. Good. I'm getting some yeses coming in. Perfect. I do want to apologize for last week's interruptions. The webinar was acting very crazy last week, so I do thank you guys for your patience. I think we've solved the problem for this week. However, if we do come in and out of the webinar, just be patient with us, okay? We'll be coming in and out back and forth as much as we need to, okay? So good, we're getting a couple yeses. And last but not least, as you've already noticed, you have the questions panel. Type in the questions if you have any kind of questions. If you want to chat, you can do that as well on the right-hand side. And lastly, if you don't want to type in a question and you want to actually speak to us, you can do that by raising your hand. There's a little hand print that you can click on, and we can unmute you and allow you to get on the phone, okay? Keep in mind that if you do want to say anything to us verbally, you have to be on the telephone. It comes out better, less disturbance back and forth. Yeah, so hope everyone can hear us well, okay? Thank you.
All right, so this is Rhonda Anderson, and we're going to today speak to transportation from the active supervision perspective. We have been trying to weave active supervision throughout our webinar series just to let everyone know that active supervision is the best practice for our Head Start and Early Head Start programs. And transportation is no exception to that. As I speak today, I am going to be referencing Child Supervision on Transportation, Attention, Management, and Active Supervision on Head Start buses, which is available on the eClick website. Children are safer when teams work together and communicate well. Transportation is no different. That means the bus driver, the bus monitors, and any Head Start staff that are a part of field trips and special events and the transportation that is involved with that. So we want to ensure that everybody is on board. You're talking to one another. Everyone knows what the expectation is. Everyone knows what the procedures are for bus evacuation drills, for boarding and exiting buses, all of those things. And programs can use the tool I'm referencing to identify and use attention management strategies, which is just everybody, all the adults on board, being present in the moment on the bus with the children and ensuring that all of the children are safe and taken care of as you transport them. So that might mean that a part of your policy may be that adults may not utilize their electronic devices during field trips because you don't want to be on the bus and have all of the adults distracted when things are happening on the bus that could injure or cause problems for our children. All right? So think about those systems, policies, and procedures, and make sure that no child is ever left unattended. Attention is the ability or power to concentrate. That means that you're observing and you're listening very carefully to all that's going on around you on the bus. So you identify and limit those distractions. You set the priorities. What are the things that I need to do to ensure that every child on my bus is safe? That means you're positioning adults effectively on the bus. Not all the children are on the front of the bus and all the adults on the back. Most of us include our parent volunteers for our transportation for field trips. You should ensure that you have trained those parents, that they are aware of what should and should not occur on buses. You have also trained your staff for your delegate agency so that they know that they're never to leave parent volunteers unattended with a child alone. That includes going to the restroom. That includes boarding and exiting the bus. There should always be paid agency staff accompanying any adult that is volunteering on a field trip. You have to stay focused and be vigilant in your observations on the bus. You have to listen. You have to watch. As children are boarding the bus, you're taking attendance. You're calling out each child's name. You're seeing where they're sitting on the bus. You're ensuring that they are properly harnessed on the bus. You are ensuring that you have an adult situated no more than 2 or 3 rows apart so that they are throughout the bus and are able to see all of the children, hear all the children, and see what's going on as you go through. You are assisting the bus driver when you do that because then he's not as distracted listening to for problems and issues. So that's called setting up your environment. You have already gone on your bus prior to the children boarding. You've ensured that the fire extinguisher is there, the seatbelt cutter is there, the horns and the backup lights operate properly. You've introduced yourself to the bus driver. You've asked the bus driver about his route. You've done all of those things. You've done your form for your pre-trip verification. All of those things have happened before you're boarding children. All of those are part of keeping our children safe. You're constantly scanning and counting. You're calling children by name. You're counting to ensure that every child that you took from your site is still with you during your trip and once you arrive back to your center. No child is to be released other than from the center. It is not acceptable to allow a child's parent to take them from the field trip destination. It is not acceptable for them to take the child before you have signed them out on the sign-out sheet for your center. You do not release children mid-trip, ever. And I hope that I made that very clear. Bus monitors recorded attendance, again, as children are boarding and leaving the bus. An authorized adult signs off once all the children are on the bus. The bus monitors and drivers scan the bus to make sure all the children are strapped in, their harnesses are securely fastened, and that there is adult supervision throughout the bus.
We have a question.
We have a question.
What are the driving record requirements for the bus or van drivers?
Bus drivers for our contracted bus companies must have national highway safety training modules completed annually. They have to have an annual physical. Their driver's license must be current and without blemish. I don't know what else to tell you. They have a very stringent certification process for our bus drivers. Driver's license as well. We don't have that. Okay. Any other questions, Jim? That's it? Okay. All right. So
I'm so sorry. One just popped up.
Another question.
Do we have to have that information on site?
No. Our bus driver records and training records are maintained at site for your bus companies. That's a part of their contract, that they must maintain those records and that they are available for review for our FSS staff as well as any federal review staff. All right, so as a part of bus safety, once you've arrived at your destination, it is important that an adult walks through the bus from front to back to ensure that all the children have deboarded, that all of the children are accounted for. Once you are all off of the bus, again, you are scanning and taking attendance to ensure that you can account for every child that got onto the bus. Once your trip is over and you are boarding to return, again, you are scanning, taking attendance, ensuring that you are taking back every child that you took to your destination. You are calling out names and touching even to ensure that each child that you have on that list is on the bus. If you find that you don't have one of your babies, you do not leave without finding out where that baby is and getting them safely on the bus. All right? Whenever possible, somebody other than the driver and the bus monitor, which means it could be one of your volunteers, should go through the list a second time before you leave your destination and return to your center. You should be alert to all sounds and sights, even quiet, because most of us know when children get very quiet, if they're not asleep, something's going on, and you want to ensure that it is appropriate and that they are safe. We know that children are not typically quiet on a school bus unless they're asleep. So please make sure that you're also concerned about silence. If you find that a child needs support, if for instance they're anxious, they are crying, they're unhappy, as quickly as possible you need to get to that child to ensure that all is well and to calm them and redirect them if necessary. When transportation teams use all of these strategies, what we are finding is that children arrive safely to and from their destination without incident. It is behooving to all of the adults on a field trip to ensure the safety of our children and families. If we find that there are issues, they need to be reported immediately upon return to your center director or your program director so that it can be resolved and taken care of. If the issue is with one of your drivers and the bus company, that too needs to be reported to your site director or your program director, and the bus company needs to be made aware of the issue. If there are no questions about any of those things, that's active supervision as it pertains to transportation. What I would like to say at the end of my presentation is that I have given lots of opportunities for any delegate agencies who are providing their own transportation to contact me to let me know what is going on, what you're doing, and how you're doing it. I have yet to receive anybody's notification that you are in fact providing your own transportation, and so the assumption is that everyone is using our approved transportation services. There is no outside transportation happening, and we don't have to worry about it come October, November when the review comes. If that is not true, you still have an opportunity to reach out to me so that we can together decide how we can best work through whatever it is we need to work through to ensure compliance for the review. Thank you for your time and attention, and I am going to turn over this. I'm sorry, there's a question.
Chicago Child Care Society will be contacting Rhonda. We have some follow-up to do regarding our transportation.
Thank you very much. I look forward to hearing from you soon. I'm going to turn this presentation over to Gina Pasella, who is going to talk about transportation from the perspective of dealing with children with disabilities and their families. Gina will work with Alicia to talk about some of the instances that we deal with children with disabilities and transportation.
Good morning, everyone. This is Gina Pasella, CPS-DFSS Disabilities Team Leader. I'd like to start out our conversation when we think about children with disabilities and their transportation needs, just as a point of reference to talk about the federal laws that govern transportation services, particularly for our children with disabilities. All of you should be familiar with the Individuals with Disabilities Education Act, which we refer to as IDEA. Under IDEA, there are many regulations, one of which governs transportation. Transportation is considered to be a related service. So when a child has a primary disability of developmental delay, cognitive impairment, autism, we make determinations about what support services or related services that child may need. It may be speech services, occupational therapy services, and in this situation, we look at transportation as a related service. transportation to ensure that the child is able to access their IEP services. When we talk about transportation under IDEA, transportation can include travel to and from school. It can include travel between schools, and it can also include transportation in and around the school. Oftentimes children with special needs may require specialized equipment such as adaptive buses, lifts, or ramps in order to access their transportation services. As you know, in an IEP, when decisions are made regarding children's eligibility for services, the question is always asked as to whether the child will need transportation in order to access their services. So it is the responsibility of the IEP or the individual education program team to make that determination. In Head Start, what we ask is that you help the IEP team come to that determination. So when decisions are made about whether a child or not is eligible, we have to look to, does the child have limited problem solving, limited cognitive ability? Is this child a flight risk? Does this child move like other children? Are they fully ambulatory, or can they move independently? So there are a series of guiding questions that the IEP team will ask to determine whether or not a child is eligible for transportation. In addition, they will be asking questions about what accommodations and modifications are needed for children. This may include, as we know, special equipment. Again, it may be an adaptive bus. It may be a bus with a wheelchair lift. It may be a personal safety harness. At Chicago Public Schools, some of our children require personal safety harnesses that are fitted appropriately to the child based on their weight and height. That may be one scenario. We also look at what training is needed, perhaps, and also never forgetting about confidentiality. So when we're training, as Rhonda mentioned this morning, bus drivers, we want to ensure that the bus driver, the aide, the monitor are fully informed about the child's special needs. And we also want to preserve that child's confidentiality, and that's a key part of IEPs and IDEA. And then finally, we have to think about emergency preparedness. If there is an emergency bus evacuation, who is responsible for ensuring the child with a disability is evacuated quickly with the other children? Is there a quick release on the wheelchair to help ensure the child can be evacuated quickly? So we need to make sure that people are trained, are responsible, that they have that adequate training, and if they're absent, who is the alternate? We also need to determine what timelines. We have to ensure that all of these things are in place before that bus arrives to pick up the child. If the child doesn't have the appropriate equipment, doesn't have the bus monitor on the bus, you're not going to load that child. We wouldn't want you to. Okay. Okay. As Bea mentioned this morning, we're very fortunate to have Alicia Castaneda here with us, who is also our Disability Services Co-Chair for the Disabilities Policy Committee. And so I would like her to talk a little bit about our transportation plans. And in Head Start, when we think about transportation plans, our goal is to ensure that children are receiving all of their services, their IEP services, and the transportation plans are specific, again, to what accommodations, modifications are needed, equipment, who's going to maintain it. Is it the teacher? Is it the site director? Is it the paraprofessional? And to talk about all those different aspects.
Good morning again. I think you've covered a lot of the information already. Thank you. But I just wanted, for somebody that's a disabilities coordinator or an agency is like, okay, what is this child entitled to? What does transportation look like for this child? I always refer to, at the end of the IEP, there's a section 15, it's transportation. And first of all, it'll tell you, is the child eligible for transportation, yes or no? Second, does the parent accept transportation? Because a lot of times the parent might say, I want to drop off and pick up myself. And then in third place, as you were saying, okay, so it's a related service, but what does that mean? I pulled an example of an IEP of a child that we have, and on hers it says that related is a wheelchair lift and also air conditioning. And so you might think, oh, so she's got to travel in style, but she does, and it's related to her health needs. And so then, okay, so now we know for this child what they need and what is required. So then what we secondly do, part of our plan is to develop a schedule for each child. Bee's laughing a little bit about the air conditioning, but so then we have a schedule that is maintained per classroom and also per site at the front desk. And the schedule includes obviously the child's name, what classroom they're in, what school that they're being transported to, their phone number, the case manager's information, the bus company's name, telephone number, route number, bus driver's name if we have that, pickup time, drop-off time, and any kind of special notes, such as, you know, this child needs air conditioning, there needs to be a wheelchair lift, things like that. Is there an aid that's required? This child that I'm talking about requires an aid. So all of this is, I'm sorry? Yes, yes. And thank you for reminding me, Rhonda. Also on the IEP would say, does this child, is she eligible for an aid on the bus, yes or no? So then we have our schedule. I think the number one thing is having that relationship with the parents and saying, you know, we're a partner with you and advocating for this child. So, you know, many times the child is dropped off early in the morning and it's up to us to make sure that the child gets on the bus. And the parent is counting on us to make sure that that's done in a safe manner. We were discussing earlier about some of the concerns sometimes that arise. Maybe the bus comes to pick up and they're on the wrong side of the street. And you have a child that is autistic that, you know, most of the time can follow some simple instruction, but sometimes it's not safe to cross a busy street to meet the bus. So, you know, what do we do? You know, is it our para, our FSS, our site director? It's a whole team approach. We have to go and speak to the bus driver and very nicely ask, could you please pull around to the right side of the street? Other issues might be that, okay, in this case, there's an aid that's required, but the bus shows up with no aid. And, you know, we've had prior conversations with the parents saying, well, what should we do if this comes up? And, you know, they don't feel that it's safe, and we don't either. So then we might have to say, sorry, the child can't board the bus because there isn't an aid. At that point, we call the bus company, we call the service coordinator, or the case manager at the school, and try to get some resolution for another bus to come. But sometimes it just gets resolved another day. Also very important is, in addition to the schedule, we have a transportation log per child. So it also has the child's identifying information, the bus company's information, the school information, and for every day of the week, somebody has to sign on, saying that they were picked up, they got onto the bus safely, and I'm signing that this happened at this time, and the same thing for drop-off. So those are two, I think, important documents to kind of have. And I know that there's an example that you're probably looking at, the transportation log. Was it from Easter Seals that shared this example? Ours looks a little different, but, you know, I think the idea is to create your own that probably works best for you. You could always contact me. I can give you my phone number. It's 773-521-1600, extension 128. If any of you, you know, I gladly can share the forms that we use if that's helpful for anyone.
The phone number has been included in the chat as well, so if you guys wanted to look in the chat, you can see it. We do have one question popping up. When an IEP states securement system, what does that include? Would a seatbelt be classified as a securement system?
I believe that that's something a little bit more specialized. I don't know, Rhonda, if you could.
I'm saying no. Because seatbelts aren't even enough for our children who don't have disabilities. We always require harnesses for our children that are not special needs. For the children who have special needs or special needs challenges, their IEP typically describes the kind of harness or the restraining device that's needed for that particular child. Most of our children who require harnesses who have IEPs receive those harnesses specialized, particular for that particular child. It's been fitted and adjusted particularly for them.
And I would share with you that you will have access to some informal guidance from the U.S. Department of Education, the Office of Special Education and Rehab Services. It's quite a lengthy document, and again, it's informal guidance, but it does answer a lot of our common questions about transportation services for children with disabilities. And what I would say, that definitely answers policy questions, but in the day-to-day interpretation at CPS, you can always reach out to your CPS disability subject matter experts. And as we know, those of us who work with transportation services to support our children with disabilities, there are many steps in the CPS transportation process. There are many forms that need to be completed, many timelines, many people need to sign off on it, including the parents. And so if there are specific instances that occur and you're having troubleshooting that child's transportation services, you've spoken to the school case manager and it can't be resolved, please escalate your concerns to us. We are here to help support you and navigate through those issues. We know that it's a lengthy process. Sometimes it can take a couple of weeks before the child is actually having the bus arrive to pick them up. Things will come up. We have over 600 schools in the city of Chicago. Some schools may be misinformed and say that the parents are required to bring that child back and forth to their school placement until the bus service starts. That is actually not true, and it's not a hardship for the families. That is, we hear that commonly and frequently, and that's not accurate. So again, if there's any issues that arise with a child's transportation service, we always ask that you reach out to that school case manager. They are responsible as an intake person for ensuring that transportation goes smoothly, along with all the child's other IEP services. But when it doesn't happen, and we know it doesn't happen sometimes, please reach out to us.
Yeah, and I would add that, you know, many times the case manager at the school isn't informed as to in specifically what to do with our children. So they might say, well, we can only transport from the family's home, which again, you know, we know that that's not true. But the parent might be told this and then decide, well, then I can't do that, so my child is not going to get services. So again, you know, there's the purple form, which then, you know, we would help the parent with, and, you know, again, you know, you can get more information, but that would allow then the child to receive transportation to and from the Head Start sites. So that's important to note.
And in terms of our documentation daily and in preparation for the federal review, we do need to maintain written documentation, as Alicia talked about, the transportation logs on site, who's loading that child on the bus, who's receiving that child that day, at what time, what bus number, for our own accountability. In addition to that, we know that COPA is our monitoring tool, and so every child with a disability who has an IEP needs their transportation page completed on COPA. There's a transportation tab for that child, and you need to complete that page in its entirety. Most importantly, there is a field that contains the school in which the child is receiving their IEP services. It is imperative that you complete that field so that we understand and are able to identify the school the child's receiving services at. We know many times our preschoolers are not attending the local neighborhood school for their special education services, so it's very critical that we complete the field to identify where they are going. In addition to that, if you complete all the fields, there's a comment section on the bottom of the transportation page, and that is where you can include our paraprofessional is, you know, assisting with transportation on Wednesdays across the street from 9 to 9:30, or in the comment section on the bottom of the page, you may say the paraprofessional. Thank you. Right, where they may find the harness. Right. The child's designated or assigned harness is located in his cubby. The teacher can assist you with locating that. Anything that's important documentation of how we're transporting the child, who's transporting the child, where we're transporting the child to, that's very, very important.
We have a quick question. If field trip is scheduled, will bus companies bring securement systems, car seats is specified, or should sites have it at hand, or for a child that has an IEP? Excuse me.
Read it just one more time.
Okay, let's try one more time. If field trip is scheduled, will bus company bring securement systems, car seats if specified, or should sites have at hand for a child that has an IEP? One at hand.
The harness for children with IEPs are specialized and travel with the child. So it is always with the child. It should never be with the bus company. And while we're talking about transportation, for 0 to 3, I think we've made it clear that we are not yet transporting 0 to 3 babies on school buses. We have yet to complete our policies and procedures as it pertains to birth to 3 children. We ask that you only do walking trips for them in their buggies, in their strollers and wagons, but please do not place children on school buses because we do not have the proper harnesses in place for those children.
All right, great information. Alicia, did you have any final words or anything that you can share?
No, I would just say that, again, key is building those relationships with the case manager at the school, with the parents, obviously, and with the whole team. I mean, with anything else in Head Start, it's a team approach. You know, it's the parents, the teachers in the classroom, the staff at the front desk, and, you know, just ensuring that best practice happens and that, you know, safety of children, you know, use common sense. You know, that doesn't look safe. Maybe the child shouldn't be placed on the bus. So, again, just those things that, you know, sometimes we feel that, oh, that's not our responsibility. That's all I would say.
Thank you so much, Alicia. That was a great closing. Yeah. All right, so now what we're going to move into, and Sharita has joined us, is what your questions were about anything and everything environmental health and safety. But majority of this, as you can see, is really focused on health, education, mental health. So we're going to ask Sharita, and we're going to assist with some of these areas. And if you want to chime in and let us know how you're doing, so please feel free to do so. Also, do we have Sandy Mendez on the line? Because Sandy, I'm going to go to her to talk about radon. And if you don't mind, I'll go to her next. So Sandy, I would like for you to speak more about radon and maybe something that you've already given us, but tell us more about the schools, about the required testing, what the length of time is. Sandy?
Okay, so basically every school that has any sort of daycare facility, we have found requires to be tested for radon. Basically what the law states is as of January 1st, 2014, any daycare that is either a new daycare or renewing their license must be tested within 3 years, and then that radon test must be renewed every 3 years. So the requirement that the radon law in Illinois states is that the results must be posted up near your license so that the level can be viewed as far as what the facility, what the outcome of the test is. The results must be posted up, and basically that's just, you know, a lot of people don't really understand what radon is. Radon is something that is in the earth, that it's a gas that is released. It's colorless, it's odorless, you can't taste it. So it could be something that is in your home that you are, or daycare in our case, unaware of. And the problem with radon is that it is the leading cause of lung cancer aside from smoking or other carcinogens. So it is especially, our young children are especially vulnerable to this, and that's why now Illinois and other states are starting to require this to be tested so that we are aware of, you know, if a problem exists. Unfortunately, the law does not require corrective actions if you have a high amount, but it should be in your best interest if you have an amount that is higher than what is recommended by the federal government, that you should take corrective actions. Now, what the level that the government recognizes as a safe level is 0.4 picoliters, which don't ask me what all that means, but when you look at your test results, it should give you a number. The important things you need to look for the posting is the date that you were tested, and then the results, the number that it gives you. If it exceeds that 0.4 number, there are some real simple things that a facility can do to reduce that number. One of the things is sealing any sort of cracks, especially like in the foundation, because the radon comes up through the ground. So any sort of cracks in the foundation, the walls, around the outlets, between the floor and ceilings, any sort of gaps in between your construction, if you get that sealed off with caulk, that'll help prevent the radon from seeping in. And then another thing that they recommend is good ventilation. So we want to bring in some fresh air, especially now that the weather's nice, bring in some fans, or even during winter months, they suggest that you bring, it's called house pressurization, where you bring the air in from upstairs and blow it down. So if you happen to be, let's say, in a home daycare, if you are able to bring in some of the air from, the first or second floor and blow it down into the daycare, that will help lower your levels as well. So, and as far as where the testing is required, it is required in all the daycare facilities, and even in when Frank Bresendorf spoke to the EPA, they said even Chicago Public Schools are required at the very minimum to test in the classrooms or rooms that house or facilitate the daycare children. So basically any socialization room, any, Catholic school, public school, home daycare, it's required everywhere in every type of situation that houses or facilitates any sort of daycare facility.
Quick question, Sandy. What is it called when you bring the air from upper levels in the home?
That's called house pressurization. And it's just basically, it's just kind of sucking the air in. That's something that anyone can do. You can get other devices installed, like a heat recovery ventilator that'll do it. But as far as just, anybody trying to do it, just immediately without doing any sort of construction, you can just, put up some sort of a box fan and just help blow air in, bring air in from the upper levels.
Thank you.
All right, we have a question about family child care.
Okay, so for family child care homes, this is Juana, Sandy. And that, well, I think most of them may not be aware, maybe possibly be able to hire professionals to come in and do. So.
Well, okay, with the home cares, you can buy a kit. You can go to like Menards or Home Depot, and you can buy a kit where it tells you where to set it up and what to do and how long to leave it out. And then you seal it up and you send the results into the testing agency. So home daycares are not required to go out and hire a testing agency. They can go out and purchase these kits, but any of the commercial daycares, those people have to go out and hire a testing agency. And then CPS kind of has a little bit of a caveat. Public schools are allowed to train somebody within their system to do the testing to help, I guess, probably save money, but then they can go around to each and every school and do the testing, or a group of people that can do the testing within the CPS structure. But as far as the home daycares, you can go above and beyond and get a testing agency that'll do it for you, but you can also buy one of those testing kits. And those typically run about $150 is what I'm seeing online. So.
Then once the kits are sent off, results.
Right, and then the testing agency will turn around and send you a certificate and information as far as, where your level falls. And again, these tests, no matter if you're having it professionally done or if you buy the kit, you should retest every 3 years.
And the testing certificate would also be required to be posted somewhere, or?
Yes, so right, and that's what's going to list your level. So what your facility tested at, that's going to be what you're going to want to show, because it's going to show the date that you tested and it's going to show your results.
Okay, and then one other question. I believe Frank said that for the Chicago, the EPA said that for the Chicago Public Schools, it might be 5 years, not 3 years. Is that right?
I believe the way the Act states, it does say every 5 years. I would have to go back and look on that. But I'm not 100% sure, and I don't have the Act up in front of me. But I believe you are right in that it is every 5 years for Chicago Public Schools. Again, it says recommended, so I'm sure they will probably try to, stretch it out as long as they can. But, the home daycares and the commercial ones, the privately owned ones, are 3 years.
Andy, what is the Act?
Let me see it. Then let me quickly find that. I don't know the.
Or if you know the web address, if agencies just want to Google it. And
yeah, I mean, you can just put in Illinois Radon Act. It's actually 420 ILCS. It's by the Illinois General Assembly.
All right.
And then you pull it up, and that's the everything you want to know about it and more is on there. It's Illinois. It's ilga.gov.
ILGA.
Yeah.
.gov.
But if you just, like I said, if you just Google Illinois radon testing, you'll see it'll pop up. It's the first one that always pops up.
Great. All right, so if we hang on the line, Sandy, in case. But Sharita is now going to move into inclusion and exclusion.
Good morning, everyone. Jennifer is going to pull up the CSC website where we have our policy listed. And from my understanding, these are some policies or maybe some resources that you all needed to know if they were updated or if
Oh, I'm sorry, all on the Children's Services website. So you want to go to health. So if we scroll down, you will have our inclusion exclusion policy. I just keep going down. I have to, if you see it, keep going down. That's postings down. We have so many policies up. Not that. And it's there. Okay, it's in here. So there it is, right there. Under infectious disease documents, it's our inclusion exclusion policy. So it is as a matter of fact, Dr. Torn has looked at it, and he has pretty much, Dr. Torn, which is our medical consultant, has looked at this policy and said that it's pretty much nothing has changed. It's in accordance to the licensing standards as well as in the daycare center for Illinois, the licensing for the city of Chicago. So these are just some inclusion exclusion. It's inclusion exclusion policy with the policy. But there are some children that need to be excluded from the program for following reasons, and it's a rash with a fever, vomiting for more than 2 times in the previous hours, and it's a whole list of them. Now what I do want to say is that we also have to go into our daily health checks, and we do have daily health check policy on CSD website, as well as our log that you need to check. It's a log that we put out there, but it's for you guys you can make your own log. And I'm saying all that trying to wrap it into inclusion exclusion because I'm like, where am I going with this? It's some things that you should be able to see, such as if a child comes in and they have
mucus or something in their eye, you have to ask the parents certain questions and things like that.
All right, we have a question.
Can you provide information on the best or appropriate radon kit to purchase?
Is Sandy still on the line?
No, let me get Sandy for you.
All right, we're getting Sandy.
Okay, Sandy, can you hear us?
Yeah, I heard something about purchasing the radon kits. Could you repeat the question again?
Provide information on the best or appropriate radon kit to purchase.
Oh, you know, I would have to do some research on that. I don't know. I mean, I know that you can go into, you know, the typical big box, you know, Home Depot, Menards, and purchase them. But as far as the best, I would think as long as they are, have some sort of a government, you know, like seal recommendation on there, they should be, you know, acceptable. Something by the EPA, you know, that it's confirmed by the EPA. As far as particular brand, that I cannot tell you, no.
Michelle wanted us to know that the Secretary of State website used to have recommendations or recommended sites for which kits could be purchased. So
they want to visit that website. Thank you, Michelle.
Thank you, Sandy.
Wanted to talk about quickly was a note from your medical provider. A note from a medical provider is required, well, not from yours, from the medical provider of the child, is required for readmittance following an absence of 5 or more days. So if a child is out 5 or more days for an illness, a note from a medical provider is required. Also, I want you to know you need to case note that. You need to stay in contact with the family to make sure that everything is going good, and make sure you case note that information.
What if the agency's policy is less than 5 days?
If the agency's policy is less days, then you go with your policies. This is the recommended policy, so if you're a little more stringent than Department of Family and Support Services, please go with your policy. Again, this is our recommended policy, which is on our website, and but if your policy is more stringent, we always go with the most stringent policy.
All right. What's next on the idea?
It was, I want to go, think it was
medication. No.
Well,
classroom management.
Classroom management. So I know we had our mental health consultant a couple of weeks ago give a great presentation on some classroom management. I'm going to highlight a few things that he talked about as far as routines and supervision. He stated we need to keep our routines simple and predictable. That can help manage your classroom. Routines need to be clear and internalized. Routines need to allow children to practice executive functioning skills, emotional regulations, and positive interactions. And rules and expectations need to be clearly discussed and identified with the children. Those are some ways that we can keep down some challenging behaviors. As stated earlier, Alicia talked about a team approach to everything in Head Start. One thing that Dennis discussed as challenging behaviors is a team approach within the entire facility. The facility or the Head Start needs a clear process for identifying and addressing behaviors, a clear process for behavior planning and individualization. So those are just some things that Dennis has talked about as it relates to classroom management. And transitions. I do want to say this. He discussed there may be too many transitions going on, and transitions may be too long, and children spend too much time waiting to do nothing. Now, as adults, you know when there's a long transition online or on the telephone, your mind starts to go and do all types of stuff. You may start playing with your phone. You may do anything. So if you have too much time in between your transitions, or if children sitting with idle time, then that is another way to have some challenging behavior. And it's not that just have some challenging behavior.
And so just to piggyback on that, remember, there's a difference There are children with diagnosed disabilities that act out. You may or might, that may not be the primary disability or even one of the symptoms. So what you need to do, best practice for all children, individualized for each child. Know what their strengths, what their triggers are. Have behavioral management plans when they're needed so that you've got to arm yourself with a bag of tricks, something that you can go to immediately calm that child down. So if you're a teacher, even if you worked in a program for any number of years, or you have your own children, you know what you can do at any moment to be able to calm that child and redirect their behavior.
And I also want to say, utilize your mental health consultant at your agencies. That's what they're there for. That's what they can help devise strategies for classroom management. So utilize your mental health consultants at your delegate agencies. Any questions?
They'll just pop them in if they
have questions. So on to the next one, which is medication administration. Again, can you, Jennifer, go to that on the website? So while we're pulling that up, I just want to say that Dr. Torn, our medical consultant, has right down his medication documents on CSC. Go down, yep, down. Okay. So the medication procedure is he looked at it, he said it's pretty much the same, it's standard. Oh, I was going to say no. One of the things for us, remember, we do not give any over-the-counter, any topical, any over-the-counter medicine unless it is a physician has, order. Thank you, order. I want to say written note. Wrote a note. But a physician's order, that's the only way we give any over-the-counter medications. Such as Tylenol and ibuprofen and things like that. That's just with a physician's order. So everything is pretty much step by step. The medications need to be left in their original containers. It needs to be labeled by the pharmacist. It needs to be in a child-proof container labeled with the child's first and last name, things like that. Once all of the medication is gone or the medication, there's no need for the agency to give the medication anymore, please give any unused medication back to the parents. There's also forms that's needed when you have the medication procedure. You have a log. First of all, you have to have the parent sign a medication consent form. Now that form, Jennifer, if you could go to that, and it's in the same place. That form, Dr. Torn wants us to medication consent. Mm-hmm. Yes. He wants us to do a couple of changes to it that I think will be pretty good. So right under where it says child's name, he wants us to add the diagnosis. He thinks that that will be beneficial to the agencies. And also where it's medication prescribed, he would like for us to add the name, the dose, and the route and the frequency. The route meaning where is it done, where is it orally, topical, things like that. And that's the only update that he suggested that we make on this form. Yes, diagnosis is already there, but he wants us to flip it. He wants us to flip it and put it at the top. And then the parent log. So the medication log, pretty much, and it's on the same area, and it should say medication log. And in the medication log, each individual child that has medication that needs to have medication given to them during the school day needs to have a medication log. Everyone does not need to have a medication log. Okay, it's a question really quickly.
Can you please notify us once the recommended changes are made to the form so we can print the same for us?
Absolutely. As soon as they go up, you will be notified that the changes have been made, and it'll be posted and able to print. So the medication log, it's simple. It's the date, the time that the medication was given, name, dosage, route, and the staff signature, and any reaction to the medication or any behavioral change, and a parent signature. The parent signature, we put it on there, is for when a parent comes and pick up the child to say, well, this is what we did, this is the medication that we gave the child today, and have them sign, or whomever is picking up the child. And at the bottom of this form, every month, we would like to have the parent sign and the teacher sign just so they can review it all together within that month.
You have another question? Okay. For over-the-counter medicine, you stated it needed a doctor's note, but does it need a label?
Yes, it needs the original. It needs to be in its original container. It needs to have a doctor's prescription. It's like a prescription because sometimes they will prescribe you, prescribe the parent Tylenol, and if they're not going to give it to you in the medication, what is the pharmacy, you'll get the Tylenol from just the over-the-counter, the Tylenol, but it's been a prescription, and yes, it needs to be in the original container.
Okay.
Okay.
Maricela is asking guidance on disposal of expired medication.
So from my understanding, and I've done this just personally, contacted my local pharmacy, and they have had where you can bring in the expired medication, and I've used CVS, and they'll take it and they'll dispose of it properly. So contact the local pharmacy. That was a good one.
I have a question.
Yes.
For this log, is this log supposed to be ready and available and visible for staff and anybody coming in, or should it be a confidentiality issue?
I would say confidentiality issues. This isn't to be posted. This is to be shared with the parent and everyone. Now, in the center, everyone should know, especially if you're working within that classroom, you need to know that this medicine has been given and things like that. But no, it should not be posted up, but available for someone to see if needed, the proper personnel. Okay. So that's our medication consent or medication policy. And also we're having a training on that. It will be I think June 2nd. It's going to be June 2nd or July 14th. Dr. Torrin is trying to figure out which one he wants to do first. But we'll have a June 2nd, which is the mildly ill, inclusion, exclusion, and probably medication administration during this time as well. It will be posted on COPA, and we'll let you know very shortly. But yes, it's June 2nd. It's from 9 to 12, and it will be at the King Center.
All right, Sharita, just one more area. You're doing so well.
Okay, daily health check. Again, on the area under health, we have a whole policy and things like that on daily health checks. We have posters.
Right there. Go back up.
And just right there. See in the blue. Yeah, down here. Daily health checks.
Oh no. Cute.
No. Yes. Okay. No. So here's a daily health check poster. It's pretty much what is it, why do it, who does it, when to do it. So it's looking for the signs and the symptoms. Listen to the parents, greet them, have a conversation with them in the morning, listen to any complaints or anything that has happened maybe over the weekend. Feel for a change in the skin, something that may indicate any fever or dehydration, and smell for unusual odors, things like that. So this should be done every single morning when the children come into the classroom. And this is a guide, a daily health check guide. We also have a policy on how to perform daily health checks. And it is procedure for performing health checks, the procedure. You must perform the daily health check on each child, discuss any concerns with parents or guardians. When appropriate, assess the child's illness or injury, and on and on and on. So we have the policy right there on CSC website that you can go by to perform daily health checks. Also, we don't ask you just to do it, It needs to be documented. On that same site under CSC, this is an example of how to log your record. It's pretty straightforward. It's the name of the child and the hours, what's the classroom and when this was done for each child, done every day, every month. And so it's a legend at the bottom, talks about, first of all, mark if the child was here or absent, and then it talks about the symptoms code. Was it any wheezing, stomach ache, anything like that, you mark it on the child's attendance record or daily health check system record. But if this is an example, if you have your own, all we're looking for is that it's done every day per child, and you're documenting that. So that's something that I know the support service coordinators will come out and kind of check and see was your daily health checks done. And also they've asked for a couple of examples. So make sure that this is done daily, every single day.
I have a quick question.
Okay.
Who can I contact if I have any questions on transportation regarding a child's IEP?
Okay, you can definitely reach out to me, Gina Pasella, CPS CFSS Disabilities Team Leader. My office telephone number is 312-743-1598. Again, it's 312-743-1598. If you prefer email, I check my email regularly. My email is my initials, M like Mary, Pasella, that's P-A-C-E-L-L-A, @cps.edu. And I would be happy to help answer any questions that you have.
You had the phone number wrong.
Right.
Oh, I did?
Yeah, you put 97 as 98.
We'll apologize. I put the wrong phone number. Let me type it in again.
312.
Try again. 312.
312-743-1598.
There we go.
Okay, and I think the last one on the list was toy cleaning and disinfecting procedures. Again, we have that on CSC website. We have a policy on toy cleaning and disinfecting procedures, as well as a sample of a classroom cleaning and disinfection log. I don't know. So keep going down, and there it is, right there at the bottom under sanitation. Yep. So on this policy, this just talks about washing toys, routine cleaning, soap and water, disinfecting toys, and the mixture. Now, what do we want to say, and we're going to update this, is make sure you're using the disinfecting or sanitizing recipe or solution formula on the back of your product. Because so much has changed. It's not your simple bleach and water anymore. It is so many different items out there, like in different concentration levels of bleach, and it tells you how to sanitize and disinfect what's the formula needed. So make sure you're using that. Also, we talked about last week some pH strips to make sure that we are using it's the right level and things like that. But this policy talks about how to wash your toys or disinfecting policies. The disinfecting policy on toys and items in the classroom. And we also have a classroom cleaning and disinfection log, like the frequency. And so it talks about a frequency, and again, you can do your own. This is something that the FSS has posted. And it pretty much talks about how often, like, should you, any mild toy or pacifier, you should clean after each use, clean and sanitize at the end of the day. Hats and things like that. It's giving you a guideline to when you should clean and disinfect your toys. And there's also things that are located within the CFS licensing rules and the City of Chicago's Department of Public Health licensing. So that's just a very quick overview, a couple of resources. All this information, as you can see, is posted online. Once it's updated, we'll let everyone know that it's updated. But until then, please continue to use all the items that we have posted online. And you will have further information as it relates to the exact dates and titles of some trainings that are coming up. I know May 17th, we're having an asthma training. If you have not registered, please register for that now. It is on COPA.
All right. Thank you, Sharita. Thorough job. Okay, everyone. These webinars, just so that you know, everyone that we've done is posted. Jen can give a little more information.
Yes. Actually, Victor either has posted it or can post them to the YouTube channel. I believe CSC has a YouTube channel. And what will end up happening is you guys will probably get an email providing you with the link where you can access the webinars.
Mm-hmm. All right. And please continue sending any outstanding improvement to both Wanda and Kamaria. If you have questions related to licensing, you can send those to Jeff. As we know, transportation. Rhonda, if you have transportation issues with children with disabilities, Gina and or Rhonda, and all health questions can go to Sharita. Before I wrap up, I want each of us to just go around and say a few things. If there's anything that I missed that you want people to know about, this is your time to update them. Rhonda.
This is Rhonda. For transportation, I just want to remind everyone that your final bus evacuation drill should be scheduled. It is nearing the end of the program year. Your third evacuation drill is due to Elsie Matthews as soon as it is completed. And please reach out to your bus company, your assigned bus company, to schedule that if you've not done that.
All right, Gina.
I would just share that, again, if you have transportation issues related to CPS and children's IEPs and are having trouble navigating that process, we are here to support you. Feel free to please call me or email me, and I will ensure that we address any and every question or concern. In addition to that, DFSS will be hosting a parent rights and advocacy training. Equip for Equality will be presenting, one of their attorneys, and that is scheduled for May 19th. At the King Training Room. There'll be 2 sessions. I believe the morning is from 9 till 11, and I believe the afternoon is 1 to 3. But if you have transportation concerns in general or questions about policies and legal responses and so forth, please come, and we will have DFSS will have an attorney there to answer those questions for you.
Thank you, Gina. Juana.
Okay, excuse me, this is Juana Herrera. Kamaria and I are still looking to receive improvement plans and backup documentation as it relates to any GT reports for visits. We've sent out many reports. I know I've gotten some improvement plans, some I may not have gotten, and I've gotten documentation, but please continue to submit improvement plans for any report that you have received, along with follow-up documentation reflecting any resolutions or corrections for any issues that were cited on the GT report for your agency's sites. There's still many of them outstanding, so thank you.
And Sharita.
I just wanted to let you guys know to make sure you are updating your policies and keep checking COPA, the CSD website, for any policies that you may not have pulled down and that you need any guidance on. Also note that May 17th is the asthma training, and there's also the food handlers training, which is May 24th. It's already filled, but have no fear. We will have these trainings. Have no fear. Underdog is here. I'm sorry. I digress. We will have these trainings for the rest of this year, at least 1 day a month, 2 sessions. So you'll have an AM and a PM session. All of these trainings, the food handler certificate training will be done at the King Center. AM and a PM session. Please, unless you have been registered, please do not show up because we are pretty much full, but we have so many more that we're going to offer. So don't fret, don't panic. We will be here and we will have many more trainings. And I just want to let you know to contact us with any support that you may need.
Thank you. And then one other thing, Gina.
Yes, if I might, just one correction. I apologize. There was a change in the date for the Equip for Equality Parents' Rights and Advocacy training. Please scratch it. It's no longer scheduled for May 19th. It has been moved to May 26th, which is the following Thursday. You can look in COPA to register for that. The sessions are from 9 till 11, again, 1 to 3 on May 26th.
And again, we want to thank Alicia casting out her yay.
Yay!
And for joining us here in our small webinar room. And just lastly, we have one other question.
Who needs to take the food handlers training?
Anyone that will handle food. Okay.
Anyone. That was easy.
I mean, you know, at any point, and it's free.
Mm-hmm.
It's no cost to you all. We're providing this for you all. So, and it's a, actually, these trainings, you'll get the 2-hour food handler certificate as well as a food experience demonstration that you can take back to your site.
Wow.
Yes.
And just lastly, I want to thank this awesome team at DSSS. We've been for a few months now, and they've been hanging in there with me. So I just want to thank them. They're a wealth of information, and reach out to us. The review we're anticipating will be early fall. So we need you all to be on board. All right?
Remind us to check their playground.
Rhonda says, remind you to check your playground, indoor and outdoor spaces.
As the weather is getting
Yes.
warmer, you need to ensure that they are safe and prepared to host your wonderful, active little people.
Yes. So on that note, we will go ahead and close out. Thank you very much. We appreciate it.